pandemic hit, we realized that our patients were going to be disproportionately affected. And so we very quickly needed to pivot and try to find a way to provide the types of care our patients needed during the crisis. While we did testing, we really like to think about that as a linkage to care. So we did testing and then followed patients through if they had COVID to make sure that if they got sick, they would be able to get to care quickly, and trying to really address the morbidity and mortality disparity and gap that we were seeing in our patients. Many of our patients were in essential working jobs, and so they didn't have an opportunity to really just work from home and be safe. So that meant that we had to be there to service them, and that they were at risk and we were at risk. One of the biggest challenges up front was just getting the things that we needed to care for the community. Also, education and informing people right away how important it was to wear masks and source control and some of the other infection control principles was really important. We really started to see things wane in the spring when fewer and fewer people were running the vaccines, and we really had to pivot from thinking about how to provide more access to people to thinking about how do we engage them differently. How do we recognize the impact of the digital divide and access to vaccine? How do we recognize the impact of an information divide? And that really meant a much more on-the-ground strategy of talking to people one-on-one or in small groups to encourage them to get the vaccine. Our community was suffering along with everybody else, and there was such a need during this time to address people's mental well-being, and to do that in different ways, whether it be through counseling or therapy or just in conversations. And so, that's really going to become a larger part of our platform, thinking about mental wellness and emotional well-being, both for our staff and our patients in a different way in the future. The pandemic forced us to think outside the box a bit and deliver healthcare in different ways. And those ways turned out to be pretty helpful for our patients, whether it be remote patient monitoring or telehealth, and even really helped us to think about the messages that our patients need to hear and who they need to hear them from.